I recently did a new patient consultation and it helped reveal an important blind spot that I've had when it comes to making content for my social media channels. If you know me, then you know that I'm a massive proponent of exercise, and I believe that more people should exercise not only for their general health, but that it should be used as a form of treatment and therapy for people that have pain issues, but also other neurological issues. But there's one important and glaring exception to that rule where I believe exercise is contraindicated, and that's for people suffering with things that are related to chronic fatigue syndrome. Specifically, it's when people with chronic fatigue issues have something called post-exertional malaise. And post-exertional malaise is more than just feeling tired. People with post-exertional malaise can feel both physical and mental disability after seemingly benign levels of physical activity. Simple tasks like going for a short walk or trying to get basic household activities done can leave a lot of these patients feeling exhausted, like they have to go in bed and get rest immediately after, and then pushing them beyond that point can often leave this feeling of disability that can last for days or sometimes even weeks at a time. People can get diagnosed with post-exertional malaise by doing a 2-day cardiopulmonary exertion task, which basically is like taking a VO2 max test, but you're doing it on consecutive days. People with post-exertional malaise, when they do this test, will show a declining VO2 max when they perform this test on consecutive days. Their fatty oxidation levels are going to be poor, and they're typically going to get into their glycolytic pathways way too early. But most importantly, after they've done this test, especially on 2 days in a row, they'll often have profound cognitive dysfunction, fatigue, headaches, they'll have increased pain, and decreased cognitive performance and mood disorders as a result of doing the test, and this can last for 24 hours, oftentimes going into a week for more severe cases. I bring this up because we work with a lot of patients with POTS or other forms of dysautonomia, which may also have a corresponding post-exertional malaise and chronic fatigue syndrome as part of their symptom burden. For these specific patients, we are avoiding exercise, but we're going to look for other ways to help their brain try to cope with their illness and their disease process, meaning we're probably going to rely on a lot of passive therapies to just try to get their nervous system to take some type of sensory stimulation and get them feeling a little bit better. For some of these patients, if we are able to improve their autonomic function and get them feeling a little bit better, then there may be a pathway towards them starting to re-engage with a little bit of physical activity slowly and gradually over time.